Hey guys, my name is Haley Barnhart, and for my three critical issues project, I actually interviewed my stepmom, Christina Barnhart. She is a clinical psychologist and she works at an outpatient clinic in Boston, Massachusetts. And she actually works with low income families and low income individuals. So I texted her about the topic and she told me to give her a couple of days so that she could think about it and get back with me so that she can give me the best possible answer um, that she could provide. Her daughter, my stepsister Christine, she's also a clinical psychologist. So she kind of asked Christine what she thought was about the three critical issues as well. And she wanted to do this because my stepmom works, at the outpatient clinic, which is not private. And my stepsister, she actually has her own private practice. So she wanted to ask her to kind of give me a less biased answer. So after the few days, she called me and she gave me her answers for what the three most critical issues in mental health today are. And surprisingly, all three of her issues were policy and or insurance related. Um, so first, the issue that she had said, at least in Boston in her area, is that there's the lack of resources for severe mental health clients. In saying that, she basically meant that they don't have any psychiatric hospitals specifically for long-term care patients. This had closed down, I think she said 20 or so years ago, and another one had never reopened. So that was basically her first issue, was just the lack of long-term care in her area. Um, so, in saying that, her second and third issues have to do with insurance. So basically, her first insurance issue is that the insurance are very hesitant on wanting to pay for long-term care, which understandable. It probably costs a lot of money to care for a mentally ill patient with chronic issues that they're going to be in long-term care. Um, so, in saying that, they also want to pay providers a very low reimbursement rate for the services that they're providing. So, she had also said that it requires intense and a lot of paperwork, which would be fine, but they're not willing to pay for the services that they want their providers to give, but they want to pay them just a little bit of money. So that would be an issue. And so, in regards to that, people like my stepsister, who has her own private practice, she doesn't accept state insurance, and she won't accept it because they don't pay her for the work that she's providing. So she won't take patients with state insurance, and this is an area of concern due to the fact that low-income patients can't can't receive the care that they want or need. Um, the last issue with insurance, and the last issue in the three critical issues, is that the insurance is also putting a lot of barriers on licensing, and she said especially in regards to state licensing. Um, so also, whenever you get your license, whenever you take the test and do all of that stuff to be able to practice in another state, you also have to pay for that. So that's putting barriers there as well. So basically, with saying all of that, it seemed that her main concern is with the lack of resources and the insurance putting so many barriers on providers, making it harder for them to serve and work with clients and provide those services, which, like I had said before, puts a lack of resources there for clients and for them to get the mental health help that they need. Um, and that will be all. Thank you.